Hey guys, welcome back to the channel. For those of you who are new here, I'm Varun, I'm a trainee radiologist in the UK. Sanchit, my friend, who is the second half of the channel, is a trainee psychiatrist. Unfortunately, Sanchit is not with us today. He's not dead, he's just on holiday. Today's video, we're going to be talking about something which I never thought I'd talk about, which is the things that I hate about radiology. Now, I love my job, but there are things that I wish were slightly different. If anyone says there's nothing they change about their job, they're probably lying to you. Let's find out what I wish was slightly different in the world of radiology. Number one, lack of resources. This isn't to do with the specialty itself, however, it is to do with the way it works within the NHS, which is the system that I work in the UK. Because of a lack of resources, and by that I mean radiologists, radiographers, MRI scanners, CT scanners, there are a significant backlog of patients waiting to be scanned, or scans which have been done but not yet reported. Because radiology is such a central part of the medical system, any specialty, be that medical or surgical, need scans for their patients, and by that virtue they need radiologists, radiographers, and MRI scanners and CT scanners. Most hospitals that I've worked in so far have had at least some sort of backlog of scans which have been performed but not yet reported. This creates pressure not only on radiology departments to increase their productivity, but it can also have a serious effect on patients because patients are waiting longer for diagnoses and for treatment. A simple example might be a patient who has a MRI scan and then it's seen by their surgeon in clinic. By the time they get to the clinic appointment, ideally you want the MRI results so that they can be discussed with the patient at the clinic appointment and further treatment planned. If the MRI hasn't been reported, this can cause serious problems and quite serious delays potentially. There are a number of reasons why the funding is lacking. However, one of the reasons is that radiology is potentially quite a hidden specialty. Patients and the public don't really know what radiologists do, and without that understanding, it's quite easy to miss the importance that radiology plays in the hospitals. Like I said, it affects every department in the hospital, and by that, it can affect a lot of people. Hopefully this changes in the future, and the Royal College of Radiologists in the UK has been making a decent effort recently to bring radiology into the public eye. However, that's just one of the reasons, and who knows if things will change in the future, but fingers crossed. Number two, a bit of a contentious topic, but inappropriate use of radiology. Now, when requesting scans for radiology, there has to be some sort of clinical question that we're trying to answer. So I suspect there's diagnoses, is it actually present? Or I would like to rule out these potential diagnoses. Obviously there are exceptions when you have trauma scans where you're just not sure what's going on at all and you just need some sort of imaging. The vast majority of clinicians use radiology very appropriately and discuss things with us as and when they need to. Inappropriate requests usually take one of two forms, so requesting an inappropriate scan to answer that particular clinical question. A simple example of this is requesting a CT scan to look at nerves, for example. That's a very basic example, but these kind of things do happen. The second type of inappropriate request is requesting scans for diagnoses which cannot be made radiologically. In the vast majority of cases, this is junior doctors still in training, much like myself, who simply don't know what is and isn't possible by radiology. In 99.9% of cases, having good communication skills and having a discussion with the referring doctor and making them aware of what is and isn't possible leads to a decision being made which is in the best interest of the patient. On the odd occasion, you can get slightly prickly characters who insist on a certain type of investigation being done. For me, I escalate these things up to my consultant because A, I could be wrong. I'm again a doctor still in training, but B, if I am right, their consultant needs to have a chat with my consultant and they need to have a grown-up conversation. I think it's up to us as radiologists to make people aware of what we can and can't do. At medical school, radiology simply is not taught very well. Thinking back to my time at medical school, I think I had 2-3 hours on chest x-rays. CT scans, MRI scans were just a complete myth. There is a tendency amongst radiologists sometimes to get frustrated and express their annoyance at people requesting things inappropriately, but this does not really achieve anything apart from make us feel better in the short term and leave the other person feeling a bit confused and annoyed. Number three is something which I hate and also kind of like. It's the breadth of knowledge that you need as a radiologist. Radiology is one of the last specialties where you can be a true generalist. By this I mean you know about and deal with things from various specialties. That can be medical, surgical, even psychiatric. No matter what type of radiologist you are, when you're on call, it's very easy to get a scan which is outside of your subspecialty interest. So for example, if you are a musculoskeletal radiologist, you will certainly be getting CT abdomens for acute abdomen, and you will have to report these and produce a useful and helpful report. The upside of this is that it keeps things very interesting. I never really have a boring day at work because I like various parts of medicine and surgery. The downside is you need to do a lot of reading in your own time. Learning how to report the scans by looking at the anatomy is one thing, but understanding what those findings mean in the context of conditions and management pathways and other investigations is a completely different story. Radiology exams are notoriously difficult, and this is one of the reasons why that is the case. So not necessarily a downside, but just something to bear in mind if you want to do radiology. And finally, number four, something which I never thought I'd say, but the lack of patient interaction. So back in the day when I was roaming the wards, I actually used to quite enjoy talking to patients, generally had quite a good rapport with them, but it's never something that I thought I'd miss once I stopped doing it. Now in radiology there are certain patient-facing aspects, so I do ultrasound lists, sometimes I do interventional radiology lists, but there's no real long clinics, long ward rounds where you get to talk to patients. And the main type of person I miss talking to is the nice old people. My first job as a doctor was a geriatrics job, and old people are generally just really nice. They love telling you stories about their childhood, their children, the things they used to do, and generally they're quite funny because they don't care what they say. Sometimes if I've had a long day just reporting, I do miss that slight patient interaction, but not enough to quit radiology. Nowhere near. And I suspect in retrospect, I'm looking at this with rose-tinted glasses because there were plenty of patient interactions where the patients are quite annoyed or angry and they aren't pleasant interactions to have. Anyway guys, that's the end of the video. I did try and think of another point so that I could put 5 things I hate about radiology to make a catchy title, but unfortunately there's nothing I can think of. I do like my job. I suspect as I move through my training, these points will change. I might add and remove certain points, but that's more content, so I'm not complaining. As usual guys, if you liked the video, please hit the like button, subscribe to our channel, and comment down below. Apart from all that, we will see you guys same place, same time, STM Sundays. See you guys next week.